Hello everyone, welcome to this lecture. This is a continuation of descriptive epidemiology. Some of the descriptive study designs: case report, case series, cross-sectional study, longitudinal study, ecological study. Case report, we are going to write a report about the single disease in detail. It can be done for rare diseases. And case series, single disease and multiple cases. Suppose 10 people are having a particular disease, we are going to write what are the manifestations are common in them in detail about it. That is case series. Now cross-sectional survey or cross-sectional study. So single examination of cross-section of the population at one point of time. We are going to ask about the exposure details, and then we are going to ask about the outcome details at a single point in time. So the steps in the cross-sectional studies define the research question. For example, is there any relationship between smoking and cancer? This is our research question. Define the study population, to whom we are going to study. It can be a urban area, it can be a village, it can be a district, it can be a village, it can be a state. According to sex, males or females we can take, or children we can take, adolescents we can take, or we can take according to specific occupations. For example, teachers or drivers or bankers or doctors. And data collection on exposure and outcome. In 2x2 table, always at the upper area this is positive and this is negative. The exposure will come always in the left side. Exposure positive and exposure negative. So here A, B, C, D. When we put the data according to this, we may get 4 possible subgroups. So exposed person having the disease, exposed person not having the disease, and non-exposed person having the disease, non-exposed person not having the disease. Now data analysis. We have descriptive statistics, we have inferential statistics. Descriptive statistic, we are going to just write how it is distributed. For inferential statistics, we are going to use statistical associations and all. A, B, C, D. This is negative, this is positive. So exposure positive, exposure negative. Here prevalence of disease among exposed. These are the exposed group. So disease is A. Among what? A plus B. We can compare this with prevalence of disease among non-exposed. So non-exposed group is this much. Disease among non-exposed is C. C divided by among what? C plus D. And we can also do prevalence of exposure among cases. Total cases A plus C. Exposure is A. A divided by among A plus C. Now prevalence of exposure among controls. B plus D are the controls. In that exposure among controls. So B by B plus D. Now inferential statistic, we'll be calculating association between the exposure and the outcome. So we may use some of the tests like chi-square test or t-test according to data type to check is there any association between these two variables like smoking and cancer. Now the next part is interpretation of the results. What we get from this cross-sectional study is magnitude of the disease, otherwise called prevalence of the disease, as we studied earlier. And we may get what? Significant association is there or not, right? From the inferential statistics. What is the limitation of the study? Limitation is causality is not established. Example of prevalence studies: prevalence of anemia in children. Census, one time we are going to collect the data. Knowledge aptitude practice study, prevalence of hypertension among doctors. So we will be checking the blood pressure and other related details at one time. We are not going to do follow-up. Longitudinal study, we are going to do multiple follow-up. We'll start the study, we'll gather some data. After some time, we'll be go and check the outcome. And again, after some time, we are going to check the outcome. Again, we are going to check the outcome. This is how longitudinal studies are done. The steps in longitudinal studies is same as cross-sectional study. First, define the population. In cross-sectional studies, we'll be gathering the details of exposure and outcome at the same time, but in longitudinal study we will be taking the details of exposure, not the outcome, and multiple follow-ups are done. So, and then data analysis, right? What are the calculation we are going to do here is incidence rate, is number of new cases for a period of time, right? Initially there won't be any disease, after some time disease is going to develop. So in the cross-sectional study we are going to study the prevalence, all cases together. Here only the new case. Relative risk can be calculated by longitudinal study, not always, but okay. For example, BP monitoring. BP monitoring from happens from the childhood. We'll be taking records. Will after every year we'll be asking them to come follow up. We'll be checking. It's a longitudinal study. Growth chart. Growth of the child will be monitoring for long time. That is also example for longitudinal study. Limitation is causality not fully established. There are some criteria to tell that this disease is caused by this. Longitudinal studies can't prove the causalities, but they can prove the temporality. Temporality means which one comes first, either a risk factor comes first and then only disease happened. This can be proved here. Risk factors always precede the disease. That is temporality. In cross-sectional studies, temporality is also not established and causality is also not established. Now, ecological study is at population level. For cross-sectional and longitudinal studies at individual level, we are going to measure blood pressure or ask the data individually. But in ecological studies, as a group, we are going to see. We are going to compare. So often it uses the existing data, documents we are going to review for this study. It's quick and inexpensive. X-axis we have chocolate users, and y-axis we have Nobel Prize winners. China less Nobel Prize winners, and chocolate also they are not using much. Switzerland and Germany is using more chocolates. Nobel Prize winners also more there in Switzerland. So the country wise it's a large group, they are going to compare. Limitation is ecological folly, that is country level data we can't apply for individual level. And case report, simple technique, inexpensive. The limitation is decrease external validity. Symptoms, whatever we studied, it may not be there in the people in the community. Case report, case series, sectional study, and longitudinal study, ecological study. Hope you understood the lecture and thank you for listening.